Schizophrenia is a serious mental illness that affects a little over 1% of the American population, and a very small portion of that 1% are under the age of 18. Childhood onset schizophrenia is harder to diagnose and to treat than adult onset schizophrenia, and oftentimes they are given a worse prognosis, but because of new treatments, including advancements in antipsychotic medications, more children who suffer from early onset schizophrenia are being helped, and there is a hope for their future. I would like to invite you to learn about a terrible disorder that torments a handful of American children. Schizophrenia is very rare in children, only affecting around 1 in 40,000, where in adults it affects about 1 in 100. Schizophrenia can be hard to diagnose in children because some of the symptoms of the disease can mirror a child's different stages of development. For instance, a symptom of schizophrenia can be to hear voices or see someone that is not really there, but having imaginary friends is fairly common in children between the ages of 5 and 8. One of the most well-known cases of childhood onset schizophrenia is a little girl named January, who goes by Janny. It is said that Janny was born schizophrenic. Children like Janny seem to live on the border of our world and one of their own. In Janny's case, hers is called Kalalini. Schizophrenic children are at the mercy of their mind and the many hallucinations and voices that control them. According to an article on abcnews.com called Keeping Janny Alive, The Pearls of Childhood Onset Schizophrenia, Janny saw her first imaginary friend around the age of 2.5 years old. But now she has hundreds. Some of these hallucinations can be harmless, where others can tell her to hurt herself and hurt others. In order to control the hallucinations and many other symptoms of schizophrenia, patients are often put on strong medications, such as antipsychotics, but these medications come with side effects, like weight gain, diabetes, and hypertension. While these medications can help to control the symptoms, there is no cure for schizophrenia, and the disease will persist. Other treatment options that are often used in combination with antipsychotic medications are individual and family psychotherapy sessions. Individual therapy can help your child cope with the stress and challenges that are due to their mental illness. It can help a child to deal with their condition if they understand the illness itself. Family therapy can benefit both the child and the rest of the family by educating the family on what the child is going through. It can reduce stress levels if they have an idea of what the child is experiencing. Children with schizophrenia often feel confused and alone, so it is good to show them that you support them and you are trying to understand what they are going through. Schizophrenic children tend to have problems with social skills and problems in school, so it is important to include social and academic skill training in their treatment plan. Schizophrenia is a lifelong illness, and it can be very hard to live with for the child and the family members. Becoming educated about the disease can prove beneficial to the family as well as the child. There are many support groups to help patients and their family members deal with the stress of living with schizophrenia. It is important that they work together as a family and stick with a treatment plan so their child has a chance to live a somewhat normal, healthy life. For more information on symptoms, diagnosis, and treatment of childhood onset schizophrenia, please visit childmind.org. Thank you for listening.